Health experts across the globe are sounding an urgent alarm over a growing and deeply concerning trend. Heart failure, a condition long viewed as a health threat exclusive to the elderly, is now rapidly increasing among younger adults, particularly those under the age of 50. What was once a disease primarily associated with aging populations is now emerging as a major public health crisis among people in the prime of their lives. This shift has left many researchers and clinicians both surprised and concerned, as the medical understanding of heart failure evolves alongside these new trends. Newly published research reveals a shocking transformation in the cardiovascular health landscape of the United States over the past 5 decades. Despite substantial progress in combating certain forms of heart disease, most notably heart attacks, the number of deaths attributed to heart failure has surged at an alarming rate. According to the data, heart failure-related deaths have nearly tripled in the last 50 years, even as overall fatalities from heart disease have fallen dramatically. This paradox underscores a dangerous transition. While we are successfully treating and preventing sudden acute cardiac events, we are falling behind in addressing chronic and progressive heart conditions that quietly worsen over time. In the 1970s, fatal heart attacks dominated the heart disease death toll, accounting for the majority of cardiovascular-related fatalities. Since then, improved emergency care, widespread public education about the signs of heart attack, and the availability of life-saving interventions like bypass surgery, stents, and clot-busting medications have contributed to a more than 66% decline in heart attack deaths. However, as acute care has improved, a new silent epidemic has crept in. Heart failure, a condition where the heart cannot pump blood efficiently enough to meet the body's needs, now makes up nearly half of all deaths related to heart disease, a staggering increase from just 9% in 1970. Public health officials suggest this dramatic shift reflects both success and failure. On one hand, aggressive prevention efforts have worked wonders in reducing smoking rates, encouraging regular exercise, and increasing awareness of high blood pressure and cholesterol, factors that contribute heavily to heart attacks. Widespread use of statins and better blood pressure medications have also made a big impact. But on the other hand, a new wave of risk factors has taken hold, and these are particularly affecting younger generations. The rise in obesity, ultra-processed food consumption, sedentary lifestyles, and metabolic disorders such as type 2 diabetes is creating fertile ground for chronic cardiovascular problems like heart failure. These conditions don't always cause dramatic, immediate symptoms, but over time, they take a toll on the heart, slowly wearing it down until it can no longer keep up with the body's needs. This long, silent progression makes heart failure harder to detect and easier to overlook until it's too late. Particularly alarming is the disproportionate impact on younger adults, many of whom may not even realize they are at risk. Unlike a heart attack, which tends to present suddenly and unmistakably, heart failure can develop gradually, with early symptoms such as fatigue or shortness of breath easily mistaken for general tiredness or being out of shape. As a result, these individuals often go undiagnosed until the disease has already reached an advanced and more dangerous stage. Experts are now calling for a renewed focus on preventive strategies that account for these evolving threats, and for a broader definition of cardiovascular risk that includes younger populations who may be silently developing chronic heart issues. In short, while we've made extraordinary gains in fighting off sudden heart events, we now face a growing challenge in managing the slow, steady rise of heart failure, one that demands immediate attention, especially for those under 50. As the medical community raises alarms over a growing cardiovascular crisis, attention is turning toward the underlying lifestyle and dietary patterns that may be contributing to a significant and deeply troubling rise in chronic heart diseases, particularly heart failure, among adults under the age of 50. Once thought of as an illness that primarily afflicted older individuals in the final chapters of life, heart failure is increasingly striking younger working-age adults with potentially fatal consequences. Among the most urgent risk factors drawing attention is the widespread and increasing consumption of ultra-processed foods, UPFs. These are industrially produced items, often loaded with added sugars, unhealthy fats, sodium, and synthetic ingredients that dominate modern grocery aisles and fast food menus. Examples include crisps, biscuits, sugary breakfast cereals, sweetened beverages, and packaged snack bars. While they're convenient and widely consumed, mounting evidence suggests that these foods are doing serious long-term damage to heart health. Several studies in recent years have drawn direct links between high UPF consumption and an elevated risk of life-threatening cardiovascular problems, including heart failure. This emerging research is compelling enough that experts and public health advocates are now urging consumers to drastically cut back or entirely remove these foods from their daily diets. The concern is not only based on nutritional deficiencies, but also on the metabolic chaos these substances create inside the body.
This distribution shift in the types of heart disease people were dying from the most was very interesting. This evolution over the past 50 years reflects incredible successes in the way heart attacks and other types of ischemic heart disease are managed. However, the substantial increase in deaths from other types of heart conditions, including heart failure and arrhythmias, poses emerging challenges the medical community must address.
The modern diet, heavily influenced by aggressive food industry marketing and busy lifestyles, is routinely filled with energy-dense, nutrient-poor UPFs, which often crowd out whole natural foods like fruits, vegetables, legumes, and whole grains. The consequences of this shift are becoming increasingly evident. Heart failure, unlike a heart attack, doesn't usually strike without warning, but it progresses quietly over time. By the time symptoms like breathlessness, swelling, fatigue, and irregular heartbeat become noticeable, damage to the heart may already be extensive. The grim reality is that heart failure currently has no known cure, and the prognosis is sobering. On average, just half of patients live more than 5 years after their initial diagnosis. While acute triggers like heart attacks and arterial blockages remain common causes, researchers stress that obesity and poor diet are among the most prevalent and preventable drivers of the condition today. Excess body fat, especially visceral fat stored around vital organs, is not just inert. It is biologically active. It secretes inflammatory compounds and hormones that create stress throughout the cardiovascular system, weakening the heart's ability to pump blood effectively and setting the stage for long-term deterioration. The study also uncovered troubling age-related patterns in mortality rates. Contrary to the long-standing belief that heart failure is a disease of advanced age, researchers found the most dramatic increases in deaths occurred among adults under 45 and those aged 45 to 64. These trends suggest that younger adults, perhaps lulled into a false sense of security by their age, may be underestimating their personal cardiovascular risk, delaying treatment, or failing to address contributing lifestyle factors early enough. Using decades of historical health data, scientists conducted a comprehensive review of death records among U.S. adults aged 25 and older, spanning from 1970 through 2022. The longitudinal analysis revealed a dramatic reversal in the pattern of heart disease-related deaths. In 1970, heart attacks accounted for 54% of all deaths attributed to heart disease. Thanks to advances in emergency response, medications, public awareness, and surgical interventions, that figure plummeted to just 29% by 2022. However, this success story masks a more troubling development. During the same period, deaths from heart failure surged by 146%. Deaths due to arrhythmias, abnormal heart rhythms, increased by 106%, and fatalities linked to hypertensive heart disease skyrocketed by a staggering 450%. Combined, these once less prominent conditions now make up almost half of all heart-related deaths in the United States. These numbers tell a complex story of progress in one area of heart health overshadowed by a looming crisis in another. Experts warn that without a more holistic approach that emphasizes long-term cardiovascular maintenance through diet, physical activity, early detection, and systemic policy changes, the nation could be facing an epidemic of chronic heart failure, particularly among younger generations who are currently underrepresented in prevention campaigns. By the year 2022, a major shift in cardiovascular mortality patterns had become strikingly evident. Chronic heart conditions such as heart failure, hypertensive heart disease, and arrhythmias had grown to account for 47% of all heart-related deaths in the United States, a staggering leap from just a fraction decades earlier. This means that nearly 1 in every 2 people who died from heart disease that year succumbed not to a sudden heart attack, but to a chronic, often slowly progressing form of cardiovascular disease. These illnesses develop over time, often with subtle symptoms, but they prove just as deadly, if not more so, than the acute events that once dominated heart health statistics. Of particular concern is the rise in fatalities directly linked to persistent high blood pressure, also known as hypertension, which has more than doubled over the past 50 years. Hypertension is often dubbed the silent killer, because it frequently presents no noticeable symptoms until it has already caused significant damage to the heart, brain, or kidneys. Yet its role as a foundational contributor to various chronic heart diseases is undeniable. Left unchecked, high blood pressure places continuous strain on the blood vessels and heart muscle, leading to conditions like left ventricular hypertrophy, heart failure, and arrhythmias, all of which are increasingly responsible for cardiovascular deaths. Researchers behind the recent study identified a constellation of driving forces behind this worrying rise in chronic cardiovascular conditions. At the heart of the issue are 4 key culprits that have seen dramatic increases across the U.S. population over the past 5 decades: obesity, type 2 diabetes, uncontrolled hypertension, and declining nutritional standards driven by poor dietary choices. These risk factors are not isolated problems, but rather part of a broader, interconnected pattern of lifestyle-related health decline. Each one independently raises the risk of heart disease, but together they form a perfect storm that can overwhelm even the most robust medical interventions. To make sense of this evolving crisis, we turn to Professor Latha Palaniappan, co-author of the study and a widely respected figure in the field of epidemiology and population health at Stanford University. Her analysis draws attention to how the very progress we've made in treating heart attacks has ironically opened the door to a new challenge.
All of these risk factors contribute to an ongoing burden of heart disease, especially as related to heart failure, hypertensive heart disease, and arrhythmias. While heart attack deaths are down by 90% since 1970, heart disease hasn't gone away. Now that people are surviving heart attacks, we are seeing a rise in other forms of heart disease like heart failure. The focus now must be on helping people age with strong, healthy hearts by preventing events, and prevention can start as early as childhood.
Professor Palaniappan's remarks underscore a pivotal shift in public health priorities. The goal is no longer just to reduce the number of sudden cardiac events, but to build a lifelong strategy for cardiovascular wellness. This includes interventions during childhood, adolescence, and early adulthood that promote healthy eating habits, regular physical activity, mental well-being, and routine medical screening. Prevention is no longer something to think about at retirement age. It needs to begin the moment bad habits start forming. This urgent message from researchers was further validated just weeks after the study's publication, when another major investigation made headlines. This separate study examined the relationship between diet and heart health and found a direct link between even small increases in ultra-processed food, UPF consumption, and elevated cardiovascular risk. The findings were sobering. Consuming just an extra 100 grams of UPFs daily, roughly the equivalent of 2 small bags of crisps or a few biscuits, could significantly raise the risk of developing serious heart problems. While that may sound like a modest amount, it is easily surpassed in the typical Western diet, especially in meals dominated by packaged snacks, frozen dinners, sugary beverages, and artificially flavored treats. This revelation has triggered renewed calls for urgent dietary reform, not just at the individual level, but across the food industry and public policy frameworks. The clear connection between high UPF consumption and chronic heart conditions like heart failure and hypertension reinforces the need to rethink what we eat, how our food is produced, and how it's marketed, especially to children and young adults who are increasingly forming lifelong habits around convenience foods. The evidence is clear. If current trends continue, a new generation of adults could face debilitating, long-term cardiovascular disease at younger and younger ages, undoing decades of progress in public health. Unless bold and immediate action is taken to address the root causes, from diet to healthcare access to socioeconomic inequality, the burden of heart disease will not only persist, but evolve into even more complex and costly forms in the years ahead. A sweeping international review has now added even more urgency to the conversation surrounding ultra-processed foods, UPFs, and their role in modern health crises, particularly heart disease. This comprehensive analysis evaluated the findings of 41 studies conducted across multiple continents, including North and South America, Europe, Asia, and Oceania, making it one of the most geographically diverse and extensive reviews on the subject to date. The studies collectively involved over 8.2 million adults, offering a robust and wide-ranging perspective on how UPFs affect cardiovascular health across cultures, diets, and healthcare systems. The results were both statistically significant and deeply alarming. Researchers found that for every additional 100 grams of UPFs consumed per day, an amount easily reached with just a couple of small snack-sized food items, there was a 5.9% increased risk of experiencing a cardiovascular event, such as heart attack, heart failure, or stroke. Additionally, that same dietary increase was associated with a 14.5% rise in the risk of developing high blood pressure, a key contributor to heart disease and other life-threatening conditions. Considering that many people regularly consume far more than 100 grams of UPFs daily, these seemingly modest percentage increases can scale quickly, amplifying the long-term health burden for individuals and healthcare systems alike. These findings were formally presented at the American College of Cardiology, ACC, Asia 2025 conference held in Singapore, a global event that brought together some of the world's leading cardiovascular experts and medical researchers. The presentation was met with concern and calls for urgent public health action, especially given the high and growing reliance on convenience foods in both developed and developing nations. Notably, this analysis came on the heels of another landmark study published the year before, which at the time was the largest meta-analysis ever conducted on UPF consumption and cardiovascular mortality. That earlier research involved more than 10 million individuals globally and drew a striking conclusion. People who consumed the highest amounts of ultra-processed foods were between 40 and 66% more likely to die from heart disease compared to those with the lowest consumption levels. This enormous disparity laid bare the potentially deadly consequences of prolonged exposure to nutritionally empty, chemically engineered foods. An editorial accompanying these findings, authored by public health scholars from Sao Paulo, Brazil, took the warnings a step further. They wrote, "Overall, the authors found that diets high in ultra-processed food may be harmful to most, perhaps all, body systems." This sweeping statement encapsulates the broader concern that UPFs are not merely associated with heart issues, but may also contribute to a cascade of negative effects across the entire body, including the digestive system, liver, pancreas, kidneys, and even the brain. But what exactly are ultra-processed foods, and why are they so harmful? UPFs are defined as food and beverage products that have undergone extensive industrial processing and typically contain ingredients not used in home cooking. These include artificial colorings, flavorings, emulsifiers, preservatives, thickeners, and sweeteners, all designed to improve taste, extend shelf life, and boost market appeal. The final products are often energy-dense, high in added sugars and unhealthy fats, and extremely low in essential nutrients such as fiber, protein, vitamins, and minerals. Common examples of UPFs include microwavable ready meals, potato chips, sugary breakfast cereals, carbonated soft drinks, ice cream, flavored yogurts, and condiments like tomato ketchup or mayonnaise. Despite their convenience and taste appeal, these products offer minimal nutritional benefit and are designed more for profit and shelf stability than human health. It's important to distinguish UPFs from conventionally processed foods, which include items like cheese, fresh bread, canned beans, or cured meats. Foods that are still recognizable and often retain much of their original nutritional profile. While these too have been altered to enhance taste or longevity, their processing is far less extreme and does not typically involve the same array of synthetic additives or artificial ingredients. The United Kingdom now holds the unfortunate distinction of being Europe's largest consumer of UPFs, with an estimated 57% of the average national diet made up of these products. This puts the UK at the forefront of a growing public health concern, as experts warn of a ticking time bomb of diet-related diseases if meaningful dietary reforms are not implemented. With UPF consumption on the rise globally, especially among children and young adults, public health advocates are calling for more transparent labeling, stronger regulation of food marketing, particularly to children, and investment in nutrition education and access to whole foods. Without significant changes to food environments and individual habits, experts warn that the modern diet will continue to drive a silent epidemic, one that quietly erodes heart health and increases the risk of preventable death across populations.